Right. So what are your indications for doing a spinal surgery on a herniated disc in the cervical spine?
So patients generally, I'd say 90% of people who have herniated discs that are causing compression of a nerve, not the spinal cord. They get better, and with
They don't need an
time,
operation.
they don't need an operation. They get better with time. Time is probably the best modality of treatment, and they get better with anti-inflammatories. Epidural injections we'll send them for if they have unrelenting pain. And then if they respond to physical therapy, we don't need to do much more than that. But sometimes these people have unrelenting pain, and sometimes people have weakness they develop, and they fail those types of treatments, and they have an MRI that correlates with their symptoms, and they have basically given it a real go-ahead of conservative management. Those people, I think, are the best candidates for surgery.
Yeah. Voltaire, who's a doctor from the 1700s from France, once said the doctor's job is to entertain the patient while nature takes its course.
That's right.
So as you know, but sometimes, as you said, no matter what you do, these patients remain symptomatic despite all your best efforts to get them better, whether it's physical therapy, chiropractic care, interventional pain management, and really more than anything else, probably time is what's going to heal them, because people have been getting herniated discs for thousands of years. We've only been diagnosing them for the last 100 years with the new imaging technologies. But now you've got this patient who's not getting better, who's got numbness and weakness.
And she had pain on the opposite arm. So
you maybe get a new imaging study, huh?
So that's the thing. Discs can either basically sometimes progress or they sometimes can regress.